Folks, thanks for joining us today. My name is John Dubas with Premier Marketing, and we'll be spending the next 50 to 60 minutes or so discussing a category within the Medicare market, specifically within the Medicare Advantage programs designed for people with certain medical conditions. These are the chronic special needs programs that are more widely available this year than they have been for quite a number of years, and for good reason. The carriers see some of the need for these programs and the possibilities that they present as well. So if they do, we need to as well. Today's program is being recorded and will be made available on our website at premiersmi.com and on our YouTube channel and through your Premier Marketing representative. And so watch for that information in addition to some of the follow-up we'll send on the topic as well. You'll notice in the software system, there's a section for both questions and for chat. We ask that you put your questions in the question box. We find that we cover them through the course of the presentation in most cases, but we'll make certain that we address the information request you have to make certain you get full value out of today's presentation. Also wanted to make certain that you realize that you control the volume of this presentation. So if you can hear me well, kudos, thank you. If you cannot, please adjust the volume on the device that you're using to access this system. And with that said, we'll make certain that we do a bit of level set as to who Premier Marketing is to start. For those of you that may not be as familiar with us, we are a national marketing organization founded in 1968. That's part of the Integrity Marketing Platform. Offices across the country. We're licensed in all 50 states. We act as an insurance wholesaler working through independent insurance agents such as yourself, with contracts available at the highest possible commission levels, with recruiting contracts available to those who qualify. That is done through a complete portfolio of products aimed at our niche market, which is the senior market. And we have then the base medical programs for the Medicare recipients that include Medicare Advantage and Medicare Supplement plans, the Part D prescription drug programs, but also a full portfolio of life insurance, final expense products, and pre-need plans, and long and short-term care programs, disability income plans, and ancillary benefits that layer on top of whatever other package you have on a fee-for-service basis in the areas of dental, vision, hearing, critical illness cancer plans, hospital indemnity programs, accident plans, and even a telehealth program. That Medicare Advantage portfolio includes the national carriers and many of the strong regionals in your area that can make a difference for you in your market, with that same philosophy carrying over into the prescription drug programs, where the majority of these are available as part of the contract you have with the MA carriers, with a couple notable exceptions. The Mutual of Omaha offering is PDP only and separate from any other part of their portfolio. And the Clever RX program is actually a discount plan, not a prescription drug program itself. The Medicare supplement arena has the biggies in there, a diverse selection for you, and we have support programs in play to help you be successful in this space as well. When we speak of those ancillary products in each of the categories, you have the leaders in those offerings available to you, not only to address the needs of your prospects and clients, but also give you additional marketing opportunities and revenue streams for you and your agency. When we look at the Medicare market overall, and you speak of the aging of the baby boomers, the silver tsunami, 1 every 10 seconds, 10,000 plus a day, we're talking about the people aging in to Medicare. But they don't all access their benefits fully when they are first eligible for one reason or another. Pandemic concerns with some of the challenges with money. Some of them were like me, a tail end baby boomer who's waiting at least until the age of 67 so I get my full monies out of Social Security. Whatever the reason may be, that shortfall is made up for by the folks that qualify for Medicare because of disability. And that's 15 to 17% of the Medicare population, a key market for the topic we discussed today. And that's because, well, you look at it, the Medicare population overall, 2/3 of them have 3+ chronic conditions, and they have some challenges with income and assets as well. So having programs in play that both address the need and the ability to pay for it is a key factor in our helping the population we visit with, because, well, they're getting into special needs programs on a growing basis. So if we're not helping them, someone else is. I hate when people say that to me too, sorry. But you'll see that the vast majority of folks that have been in are in a special needs plans, a lot of it's been in the dual beneficiary area, which of course, that's another topic. We actually completed a webinar earlier today on one of our carriers, DSNP, dual special needs programs. So part of the follow-up you'll receive is linked to a generic piece on other programs as well. And we do so because we want to address all the choices an individual has, because they don't have to do a thing. They can decline Part B if they wanted to. Thankfully, most don't. Some will choose to self-insure for the medical expenses not covered by traditional Medicare. Some will pick up that standard Part D program to cover or help cover with some of the prescription costs. Others opt into a standardized, modernized Medigap, Medicare supplement program, and many of the others, as we'll see in a moment, have chosen to bundle their benefits into a Medicare Advantage plan, in which our topic today with chronic special needs programs, this is the category they fall under. And we see that it's been a pretty even split for folks coming into Medicare as to what choice they take. However, the last couple of years with pandemic influences and many folks becoming much more comfortable with doing some things electronically, you're seeing an increase in the Medicare Advantage plans. Well, it's one of the reasons over the Med Sups, but we still need to make certain we address all their needs. And that includes translating the language that this information is being provided to them from acronyms. So this guide from CMS is a very helpful resource in that area, but it also reminds us that if we don't know what that acronym means, I've been doing this for a long time, every now and then one pops up and you go, holy cow, what's that mean? Well, this enables us to not only translate that acronym, but remind us that we should limit our use of acronyms in our presentations to make certain that folks understand what we're talking about. Helpful tool. Election periods, we've got regulation as to what we can do and when with different Medicare programs. We see that the standardized election periods are being completed at the end of this month. OEP, we can't really advertise for it anyway, but we have all these other special election periods that we can make use of, both the standardized pieces that are listed here, and that includes that special election period for chronic special needs plans. We'll discuss that in a moment, but also some additional special needs programs brought about by certain circumstances beyond reasonable control. That includes Mother Nature and some other reasons for folks to have an opportunity to check their coverage and change with the use of this special election period. When you have CSNPs involved, when you have these chronic special needs programs, there are some different ways that this entitles folks to switch throughout the year, as I referenced, and that includes certain disabling conditions, as they put it. Well, disabling isn't necessarily disabling, but in those circumstances, we have the opportunity to look at different SNP programs throughout the year, and that's important because surveys conducted by Kaiser Family Foundation and other organizations have shown the vast majority of people on Medicare aren't doing it annually. And we know how plans can change regardless of what the base program is overall. And we want to make certain that they realize they have options, even throughout the year, that could better address their financial wherewithal. And that includes, however, they're getting that drug coverage, because that's the thing that changes the most. Plan benefits can and do change to one degree or another, but the portion of that coverage that affects the financial obligations more often or not comes from the medication coverage. And they're not even using some of the governmental tools that are out there to help them discover what those circumstances are. So we have the ability now to deliver information a couple of different ways, either face-to-face, in-person seminars, however we do our business that way, but also on a virtual basis. And so we want to make certain that we not only deal with carriers that can help us in this regard, but also organizations such as ourselves that may have the tools for you without cost that can deliver this information and the ability to switch back and forth through the course of our presentation. So let's look at it from a realistic point of view. The folks in the category we're addressing are becoming increasingly digitally savvy because they're trained to do so. Through the time period we are still in, to a degree, one way or another, many of them visit their doctors or specialists virtually. Some of them are doing their prep work for hospital stays or visits to the dentist or other Medicare providers digitally. And hey, other aspects of our life, including celebrating our faith, are all done online or made available online. So they're more comfortable in this area. And we want to make certain that we're fulfilling the needs they have along with our own in the delivery of messages. And also, it's a great way to document you sent certain things and cover your tuchus when it comes to a compliance basis as well. So when we look at marketing chronic special needs successfully, I want to make this proclamation, and that is the fact that just because someone is eligible for a chronic special needs program doesn't necessarily mean they're sick or whatever. They're dealing with a health circumstance that doesn't necessarily preclude them from purchasing additional products. So keep that in mind. But special needs programs, they've been around for quite a while now, almost 20 years, through different pieces of legislation since then. They have been solidified, limited, expanded, whatever it happens to be. But you'll see that the legislation history is there in support of these programs. And they're generally on an HMO or PPO basis. They have certain benefits that come with the special needs plans where, dependent upon their health circumstance or whatever the plan is, that the plan may actually tailor the benefits for that population, provide providers within the category that deals with that illness, and then also may have special drug formularies that address those conditions. So we see then that there are a number of ways that these plans specifically address different needs of the population. So when you look at special needs plans overall, there are three types. The one you see most often, as we demonstrated on that slide from Kaiser Foundation, Family Foundation, that's being utilized the most, and that's the dual special needs area. Another category we discuss in other webinars and have other detail there for you, but there's also institutional SNPs for folks based on where they live. Many cases, this is not available to the broker community, so we don't spend a lot of time on it. But under chronic conditions, these are listings of some of the severe disabling chronic conditions a person has in order to qualify for a program. Now, keep in mind, just because these conditions are listed here doesn't mean that plan is available anywhere or specifically in your market. So the things that you see most commonly deal with cardiovascular difficulties or diabetes in most circumstances. So you'll see then that that gives us a great portion of the population to deal with because, hey, we talked about 2/3 of the population have 3 plus. Well, 80% of the population has at least one, 77% at least two, and the most common chronic conditions for adults 65 plus, because that is the majority of people on Medicare, is why we're using this statistic. A lot of that is right in our wheelhouse for the chronic special needs plans that are most commonly available. To enroll in a chronic special needs plan, an individual has to have that Part A and Part B of Medicare. They have to have a specific chronic condition that qualifies for them plan, and that has to be verified by different sources, most commonly through the physician that's dealing with that plan, and that individual has to live in the service area in which that plan is available. So it will vary from market to market, but also is a way for us to help people throughout the year because that chronic SNP is available to them for that condition one time a year. If they have more than one condition, however, they can utilize a second time for chronic special needs, but not for the same illness. So this basically runs back through the fact that there may be special programs specifically set up for the folks through these plans and can be beneficial to them. We do, however, want to make certain that we do an analysis of their needs and get them the comparisons they need to make choices, because simply because they qualify for a plan, well, it may not be their best selection based on other needs that they have as well. So we want to make certain that we're doing the best to deliver the information they need to make certain that they're maximizing the value and the benefits they have through different offerings in their area. And so we can use our Medicare Center, which we'll talk about in a little bit too, but also because many folks recognize the detail coming from the governmental site with Medicare.gov, we can use that to verify what plans are available for that individual, but also give us an indication as to, hey, is there one available in my market? How do I find them? And what benefits are specific to that program? So we can go into Medicare.gov, check the plan, check the help find plans, and then look at those plans specifically. Continuing without logging in, you don't need to create an account to access the benefits. And we can then specify the area that we're looking to find that information in. So we're looking at Medicare Advantage plans. We're going to go in there and do a filter for plans with people with chronic or disabling conditions, and then find out the number of programs that are available to these individuals. So when we look at in this particular market, I utilized a zip code close to me in North Dallas, so Dallas County, a big market, and we see that 67 Medicare Advantage plans being offered in 75248. 10 of them are chronic special needs programs, and it gives us some base detail as to what additional benefits they have by enrolling in one of those programs. So let's look at specifically how we find these programs. And so we've gone into Medicare.gov, we've gone through those specific ways of accessing this information, and it gives us then the detail of these programs on a generalized basis. This then brings up the detail we need to speak to the different carriers and find out specifically some of the key components as to why someone would make this choice. So looking at formularies, entering their drug information, because these are pulled up without adding any medications that are part of it. And that's important for us to use to help determine the value of these plans to the folks we speak with. For our purposes, I just wanted a listing of the plans that are available in the area and what the details are with them. So it gives us then the idea that we need to speak with a couple of different carriers, work our relationship with those agent managers to help determine why their plans, why they're going to be able to help us market those programs and how they're going to support that initiative, and make certain that we go through and do a comparison of those plans for that individual that includes network, medications, and some of those other key programs that are available to them. And as demonstrated in this particular carrier, is it an HMO or a PPO chassis on which that plan is laid out? Because no plan has every doctor in the world. We don't necessarily know what kind of relationship our folks have with their providers until we get into that discussion, of course. And so we need to make certain we know that, okay, if it's an HMO product, what's the network that's involved? What all comes into play in that area? And how we can make that work for the prospects or the clients that we're discussing these options with. Really kind of a quick way of going through the Medicare.gov website in order to do so, but we wanted to make certain that you could see that detail and figure out how to work that program, that subset of the Medicare Advantage plans, and determine, gee, is there one even available in my target market? So we want to make certain that you see that detail and that we can deliver that information appropriately, accurately, compliantly. And so work through that information. Part of the reason why we'll actually look at some of these programs within the chronic CSNP offerings is the fact that they are one of the key categories, along with the dual special needs program, that offer those additional benefits we see sometimes in regular MA plans, but not necessarily the same or as frequently. So those benefits that are laid out, part of the social determinant of health initiatives that are out there, that layer on many of the extra benefits that are specifically helpful for the population we're addressing. Hey, we've even got a CSNP plan here in Central Texas that offers help with air conditioning for folks with cardiopulmonary difficulties. So there are specific extras we want to make certain that are made available to this population. And if they are a key determinant as to plan choice, well, that's up to them as long as we cover our basis with everything else that we're detailing. That we're not out just selling a dental benefit or out speaking to just one program or another. We're doing our compliant presentation and discussing the entire portfolio of benefits they have, but also making certain that we can use some of these extra benefits to help them along the way in choosing a program that may be most appropriate for them. So we want to make certain that we've done our homework, that once we gather this detail and we begin to discuss these programs with our prospects and clients, know the plan and the network, because the benefits and how they're delivered, of course, are of key importance to us in making certain that they understand the options they have. We want to make certain also that we know whatever assistance programs they may qualify for. We're talking about folks that have a true dual beneficiary uh, qualification. Well, even if they have a chronic special needs plan, that dual special needs plan may be their better choice. And if they don't qualify for all of that type of uh, qualifications for the DSNP, we know we can go up to 150% of federal poverty level and still get them help with the costs of their medications. So even if we're enrolling them into a chronic special needs plan, if they qualify for that help with the costs of their medications, those lower copays are going to take precedent over what's laid out as the copayments for their medications within the CSNP. And so we want to make certain that we are aware of that and that we can help discuss those extras that they get through that extra help program, that low income subsidy. I like to refer to it as extra help because low income doesn't necessarily strike a chord with a whole bunch of folks. And because we're going through and making certain that we're getting the information we need to properly present choices, we may well be setting ourselves up for a longer appointment. I know a lot of folks on certain social media platforms will say, "Hey, I enrolled this person in 15 minutes." Boy, by golly, if they did, I'd like to know how they went through and did some of their homework. I'd also like to know how they went through and did that compliantly. If they do it through multiple contacts, I understand, but we want to make certain that we are prepared for any questions that come up, but those questions may also reveal other individuals through a referral process that, well, they make that time well worth it. We also want to remember that a SEP will work both ways. So if a person qualifies for a special election period through for multiple reasons, we need to realize that we're delivering the information they need to properly make a decision, but also properly stick to it. And we do so through conversations not only with that beneficiary, but sometimes it may entail involving other influencers as to that decision. A lot of it deals with family, children. If you want to call a 60-year-old child, well, the offspring of the folks that qualify for these programs, they may well have a voice as to their choices that are there. So making certain that we take care of that involvement can be crucial in not only enrolling folks, but keeping them on the plan. And because these plans have their different idiosyncrasies, they have their different networks and other things that come as part of the program, Working with the carrier on their trainings for these programs can be very, very helpful for us, not only for the information we need, but also to increase that partnership that we have with the carrier so we can get additional help in marketing and other programs that way as well. And then, of course, making certain that we utilize the appropriate material through both the carrier, and there is governmental support material available as well. There's also the opportunity to cross-sell with these programs. Since this deals with health conditions and not necessarily income and assets, utilizing one of the programs available on Medicare Center, the CSG actuarial program, it gives us the opportunity to identify different possibilities as to that cross-sell, because they are perhaps someone with a diabetic qualification. They may need additional dental coverage beyond what the plan offers. And so you have fee-for-service programs within that area that enable you to cover that need. There may also be folks that need help with the copays when they go into the hospital. So dealing with different hospital indemnity programs is a great offering as well, particularly if you get into a home and they say, well, you know what, I appreciate the information. I'm quite happy with the MA plan I'm on now. I'm going to stick to that. Do you give up? No, not necessarily. You identify that plan specifically, use this program to set that up as the base program, and then you can fill the gaps, so to speak, with a hospital indemnity plan. Great way to still get a sale out of that individual, add them to your book of business, give you the opportunity to stay in touch. So if their needs do change or if their base plan changes, you're there to help them in that regard. You do also have the opportunity to help them with final expense programs. But keep in mind, once you've collected that scope of appointment and that first discussion deals with health programs, you can't discuss final expense in that same appointment. That's a 48-hour cooling off program, but that's the same if you were to talk about other life insurance or long-term care needs, any of the other programs that are considered non-health programs. A great tool for you to use, though. And that includes the possibility of guarantee issue products within the life insurance arena. That can be very helpful for you as well, and give them other ways of accessing that life insurance through chronic and terminal illness riders. That can be very, very helpful for you. A different world from what I discuss, but we'll make certain that if that is of an interest to you, we set you up with a subject matter expert in that arena. Why would you want to do some of these programs with us today? Well, Premier Marketing does give you the opportunity to contract electronically, store your information by creating an agent profile through SuranceBay. When we speak to some of these carriers that offer the chronic special needs plans, they may well have a direct electronic link. We want to make certain that we're delivering your access to these programs as quickly as possible. And sometimes that SuranceBay, sometimes it does not. So keep that in mind. We do offer discounted E&O for qualified agents. What makes you a qualified agent? Well, you got a contract with us. But this enables you to own an errors and admissions coverage that is yours. You own it. And it will satisfy the requirement for this coverage for the carriers that ask for it, and that's the vast majority of them with whomever you contract. You get a discount if you're working with our carriers only, but we realize we don't offer everything to everybody, nor does anyone else. But we want to make certain that you cover yourself in this regard, not only to satisfy that requirement from the carrier, but protect yourself as well. We do also offer discounted continuing education programs through our association with WebCE to keep your license in play. And you have a way of adding to your own benefit package through a modified guarantee issued disability income plan for yourself, on which you're paid a commission on yourself. Something to consider. Much as where today's presentation is being recorded, and as I mentioned, will be available on our website and on our YouTube channel and through your Premier Marketer, we want to make certain that you have access to other programs that help you not only understand this niche market, other niche markets within the Medicare world, but give you access to other trainings that have been recorded that you can access 24/7. And that includes means of marketing to the individuals that can be very, very helpful for you and in identifying this target market. I mentioned this and alluded to this a few times already, but your access to Medicare Center, which as a longtime ME individual, Medicare Advantage individual, I still have a hard time using that word that JJ Walker likes to use on the commercials so frequently. Free? Well, this program is available to you without cost through a contract with our organization and through our Integrity Platform partners, where you don't pay anything to use it. You have to have a contract with us to access it, but it gives you an opportunity to use multiple quoting engines through a universal login, give you side-by-side comparisons that you can use to help with distributing the information after you've collected that scope, which this enables you to do as well through various methods of getting it and storing it for that 10-year period if you sell them or not. A secure way of becoming a means of a repository for that information. It does also give you access to a CRM that is yours to use. We do not mine that information for whatever purpose. And it also gives you an access to a learning center that can give you sales scripts and other tools that can be helpful for you, all without cost through a contract with our organization. And much in the same way, we want to make certain that you're getting the full compensation you are entitled to through a sale. Well, the max comp for MA and PDP plans is set by the government. Most of the carriers deal that out right at the beginning anyway. But the other programs that we mentioned, MedSup, ancillary programs, other parts of the portfolio may well have additional incentives for you that may help you qualify for carrier trips and help through our incentive programs as well. We want to make certain that you have that detail all on a single page on our website. And so we've detailed that for you. We want to also put you in front of folks that can access these programs or have a need for these programs and how you can access them. We do offer contact lists butted up against do not call regulations that are available to you at low or no cost, depending upon your contracting arrangement with us. Keep in mind, you can't cold call for MA or PDP programs, so it kind of makes today's discussion moot. But you can use this for MedSups, all but one, or other products as well. And it's a great way for you to establish a sales funnel in that fashion. And what do I mean by that? Well, if you consider using this for dental programs, marketing to a 63 and a half, 64-year-old about dental coverage, since they're used to it in many cases through their group coverage or have need of it otherwise, a great door opener because, hey, what happens at 65 with the dental programs? Most of the time the rates go up. So it's a great motivator for someone to utilize that quickly and put it in play. Plus, they may have additional needs now that their coverage doesn't cover fully. So that's available to you. A different way of getting into a household and filling your sales funnel. We do also lay out for you assistance programs to help market within your target market on community-based programs. Retail marketing. Well, most prevalent during AEP through Walmart and other programs offered by different carriers, but some of it's ongoing throughout the year. There's a program ongoing through Kroger right now that give you the opportunity to speak to chronic special needs programs because they are a health program and are a program appropriate for that setting. But we also have ways of you to utilize presentations about these programs through your contact with faith-based organizations, a whole nother way of marketing as well that we've detailed in the past and have available to you as a link in that recording library, but also gives you another way of marketing through providers, looking at and making the primary care docs or the specialists that are involved with the program critically aware of these chronic programs and how they can affect their practice and how you can make their lives easier by working through you. A great way of expanding your ways of generating leads. As you work with different Medicare Advantage carriers, that relationship can develop into another lead source through that carrier where they're generating prospects and are sharing them with agents that are contracted and certified with that organization and have done business with them. This is a quid pro quo arrangement. Want to use Latin there to class up this act. But if you scratch their back, they're going to scratch yours in many circumstances. A great way of ingratiating yourself to that carrier and a great way of deepening the relationship with individuals within that organization that may well be the yes/no person for that lead distribution. We do have internet lead and direct mail support programs as well, as well as a T65 locator I'll mention in a little bit, but also a referrals program that reminds you how to take that one lead and have it go forth and multiply, so to speak. Important during the sales process, important in engaging your book of business later. That direct mail program, a deeply discounted cost through select vendors, and you can qualify for it twice. You can use it through the health programs that you do with us, also through working for final expense as well. So you can qualify for it twice. And we do so through those preferred lead vendors because we vet their technology to support you. They all have great CRM systems, so you're aware of a lead coming back through direct mail as quickly as possible. Make certain that you can hit it when it's as hot as possible. But it's also a way for us to make certain that we're overseeing the correspondence that goes out in order to keep you compliant. We do also have a program that helps you access direct mail responses on a per response basis through another vendor that gives us the opportunity to look at those responses in different categories, and the prices do vary from time of year to time of year, the plan type, your market, that sort of thing, because it's a supply and demand piece. But it's a great way for you to fill holes in your calendar or peg certain ways of making certain that you're active in certain areas at a very nominal fee. Those internet lead programs, well, they're through Facebook, and there's one set up for final expense and one for Medicare as well. The Medicare programs generally are a review or a Medicare number or Medicare 101, or they'll talk about med sups upon occasion as well, but we do that in order to make certain that we can keep you compliant in that area. That T65 locator that I mentioned, well, this is another JJ Walker thing. Don't know why I'm talking about him all the time, but it is free. You download the program to your smartphone, you register through your smartphone, they verify that you have a contract with us and give you access to this system, and you can actually find people based on the parameters you set up as to where they are. So if you have time between appointments and you're not afraid of walking up to someone's door and knocking on it, if that's permitted activity, can't do it for MA or PDP, remember, but for other programs, it does give you the opportunity to help in marketing in that fashion as well. Remember, I want to remind you that that referral program that we spoke of deals not only with people in current sales processes, folks that you sell and that you don't, but also the ones that you do sell. They're part of your book of business, utilizing that same mindset to go back and, one, stay in front of the individuals with whom you're conversing or have conversed with in the past, but keep them involved. It drives up your persistency, your retention across the board, and generates additional leads for you as well. You can tell I've had 4 cups of coffee this morning. I'm talking really fast, spent a little less time as to the use of Medicare.gov to locate these programs, but I think you'll see that it's pretty simple to do. We do all this simply because we want your business. We asked for it. I'm asking for it now, but it's a key component for us all because this can be a valuable portion of your personal marketing plan, depending upon what you're after and how you can determine how this can be a benefit for you. It's fairly simple to set up. Most of the Medicare Advantage programs, however, do require an additional module for this. You may already have it completed. Most folks do as they certify with a carrier. But as you make this a portion of your marketing plan, it gives you the opportunity to use it throughout the year because of those special election periods, but you can put it in play now. And it gives you the opportunity, much as what John Wayne said in the movie The Cowboys, to slap a piece of bacon in that biscuit, saddle up, and ride because you're burning daylight. Paraphrase that one. You can get it in play really quickly. So I want to check really quickly to see if my caffeinated presentation this morning brought about any questions I didn't cover. 4 of them have been covered through the course of the presentation. So that's taken care of. It gives me then an opportunity to thank you. I want to thank you for the investment of your time with us here today. Most appreciated for you to spend that most valuable of your resources with us through participation in the presentation today. But also for those of you that have done business with us in the past at Premier Marketing, I thank you for that business. For those of us that are about to work with you, but you haven't in the past, I thank you for that opportunity. But once again, thank you for your time. You can reach us, of course, through our toll-free number at 1-800-365-8208. Speak with the marketer that you're dealing with within Premier Marketing now. If you haven't been contracted with us in the past, we'll make certain that we set you up with a subject matter expert to help you in this area. Watch for the follow-up that will be sent up as well. And until we're able to visit with you again, I wish you good selling. Thanks so very much. We'll talk to you soon.